Hi, guys. This is Dr. Rupesh once again from Dr. BK Moit Institute. Just continuing from where we left, it's just because of the technology failure that we stopped it in between. So I'm just continuing where we were. So by the time they are now playing the listening, and I'm just trying to go from here only. And let me check if the battery thing is working. Yeah, it's working now. All right, cool. Uh, all right. So I'm just gonna play it now. They are going to playing the listening, and let's see what are the words that we have to be careful about. Okay, now I'm playing it.
Mind me saying so? I'm not very fond of these procedures.
I can understand that.
I'm just gonna play it from
I'm doing well.
only. Okay.
How are you today, Mr. William?
Now my first question is last checkup. Okay.
It's good to see you again.
I'm doing well, thank you. Just wanting to get this over and done with, if you don't mind me saying so. I'm not very fond of these procedures.
I can understand that.
So again, listening sometimes obviously can come from anywhere. Listening is a question paper even I can create. If I say I am dash of, so he has spoken the word I am fond of. I'm not fond of these kind of procedures. So sometimes we do not listen to it. So obviously we will all have to improve our listening. Now he said, see, I just want to get it done. I'm not fond of these kind of procedures. That is what he said. Again, you have to improve your listening. And that obviously will happen if you will do one listening 3 times. I will make you listen again. There is no blank from this line, but it can be in the final exam. Who knows what blanks are going to be? So you should improve in terms of listening that what he's speaking. Now listen to the patient again. He's very fast. See, I would just like to say to get it done. I'm not fond of these kind of procedures. So this is what he has said.
I'm doing well, thank you. Just wanting to get this over and done with, if you don't mind me saying so. I'm not very fond of these procedures.
I can understand that. Can you tell me when was the last time you had a checkup?
Now this is my question. This is my keyword. That is where I put attention. So now patient will say last checkup.
6 months ago.
My first blank is 6 months ago. So it's not a trouble at all. Now my second thing is recently participated in. So that is my preposition. Recently participated in.
All right. How have you been since we last saw you? Is everything okay?
Pretty much.
Any changes to your general or dental health at all?
I'm okay general health-wise. I've recently finished training for a marathon, so I've shed about 10 kilos and I still go to the gym regularly and watch what I eat.
Now this was really fast. Obviously nobody can fill it. But I can just try it. Marathon is the word that I think was matching. Otherwise, I don't know what was it. So in the final exam, also if there is something like that, you don't care about it. Just feel whatever you feel like. Because he again, how can I say it can be marathon? Because he's good, and when people are fit, they normally participate in marathon. It's not common in India, but in obviously in good cities like Delhi, Gurugram, Bangalore, there are many marathons that go on. So it is otherwise impossible to fill in the blank if you do not utilize your first 30 seconds. That did not come in this recording, but I will put it at the end. The video that by chance got disappeared. So we already told that in the first 30 seconds, you need to utilize, you need to make images. What kind of patient is that? Only then you will be able to fill. So marathon is the only word that's coming in my mind at the moment. But yeah, if it is not my final exam, I can learn and I can try it again. So let's try it again.
Oh,
I'm okay general health-wise. I've recently finished training for a marathon, so I've shed about 10 kilos.
That's the only word that is coming. So even after listening to second time, third time, it will not help me. So this is a hard blank. Nobody can do anything about it. So please don't overthink about these things. In the final exam, maximum one blank can come of this capacity. Otherwise, everything would be audible. So it won't be like this. This was way too fast. So can't help it. Now going to my 15th question. Reason for visit.
And I still go to the gym regularly and watch what I eat. The hygienist was very helpful in that regard. She even gave me recipes to follow, and I'd love to book in another consultation if she's about today.
I'll let her know.
Thanks. Even tooth-wise, I'm pretty much okay, I guess. I'm here because I need a whiter smile for work. I'm getting booked more for TV work, and I'd like to
Now,
best
sorry,
self-4.
sorry.
I have to smile a lot
Oh,
in my interviews, and well,
hmm. I need now, being a dentist only I can understand that. Otherwise, it was a hard one again. I need a whiter smile. That is the only word I think I can guess of again. Hard but not impossible. If you understand, again, that is what I did in the first 30 seconds. So guys, if you have started listening to this video from now, then I am putting a video at the end. Please go to end and touch that thumbnail. In the first 30 seconds, you need to understand this patient is talking about mouth, oral cavity. Otherwise, his general health is very good. There is a blood in the saliva while brushing, maybe something like that. We have to fill those blanks in. But yeah, these are the things. So the only word I can fill in is again whiter smile. Again, I will make you listen to it.
no one wants to see a presenter with stains on their teeth, you know?
Okay.
So I've shed about 10 kilos, and I still go to the gym regularly and watch what I eat. The hygienist was very helpful in that regard. She even gave me recipes to follow, and I'd love to book in another consultation if she's about today.
I'll let her know.
Thanks. Even tooth-wise, I'm pretty much okay, I guess. I'm here because I need a whiter smile for work.
Whiter smile or wider smile. These are the two words. Wider or whiter. Okay, let's see what it is.
Getting booked more and more for TV work, and I'd like to put my best self forward. I have to smile a lot during my interviews, and, well, no one wants to see a presenter with stains on their teeth, you know?
So nobody wants stains on the teeth. So that means he needs a whiter smile. That is what normally, again, being a dentist, I can tell you veneers are the things that go for. But anyhow, so we are concerned about whiter smile. So patient reason for visit, patient needs a whiter smile. Again, the only word I can fit is whiter smile. And occupation, I don't. He was saying he does some kind of interviews and TV work. Otherwise, I don't. I haven't found anything that he's talking about occupation or not. Let's see.
Congratulations on the lifestyle changes. I know that before your check, you had an x-ray which showed that everything was normal. Just
So
to be on the safe side,
so now they are talking about X-ray. So I can understand that that blank has gone. That blank has gone. Am I audible to everyone? Just asking in between. Am I audible to everyone? I'm just gonna check the chat box if it is okay because today net is working really, so I don't know why. Am I audible? All right, cool. Sorry. It's just today net, internet is definitely playing up. So yeah, that's the point. So you can fit in the words when you know about the overall topic that today patient is going to be a male. He goes to gym, so he can participate in a marathon. Then reason is this, and the only thing he was saying TV interview or something like that, which I could not figure out. But maybe interview taker or something, or he can be a TV guy. Let's listen to it once again. Okay.
Pretty much.
any changes to your general or dental health at all?
I'm okay general health-wise. I've recently finished training for a marathon, so I've shed about 10 kilos, and I still go to the gym regularly and watch what I eat. The hygienist was very helpful in that regard. She even gave me recipes to follow, and I'd love to book in another consultation if she's about today.
I'll let her know.
Thanks. Even tooth-wise, I'm pretty much okay, I guess. I'm here because I need a whiter smile for work. I'm getting booked more and more for TV work, and I'd like to put my best self forward. I have to smile a lot during my interviews, and, well, no one wants to see a presenter with stains on their teeth, you know?
The only thing I can say, interview presenter, because he is not speaking anything. Again, blank 14th and 16th were merely impossible. You can only guess, you cannot be sure about it. Even if it comes in the final exam, obviously it will not come, but that's the only thing you can do about it. Okay, so don't worry about these kind of hard listenings. In exam, obviously it would be balanced, but 13th question was okay. 15th question was also not very easy, but yeah, was okay. Let's go to question number 17. So out of 4, if you could do 2 right, that means you are good at listening. If you did all the 4 wrong, then you need to improve. If you did 1 right, then try to listen to one video 3 times so that you can do it better. Let's go to question number 17.
Congratulations on the lifestyle changes. I know that before your check, you had an x-ray which showed that everything was normal. Just to be on the safe side, I'd like to do one again before we start the procedure, if that's okay.
That's fine.
So, you said
So
that you're
now this is a typical blank. X-ray showed. Showed means revealed. Now she said there was nothing. So now the only word I can fit is no abnormalities. Otherwise, she would have spoken about abnormalities, or maybe she will speak now. But if I have to do it, then it is my common sense. X-ray revealed no abnormalities. That is the only thing I can do about it. So again, there can be some listings which are hard, but I'm not saying they are impossible to be done. You can try them, you can learn from them. Obviously, exam would be little easier than this, but you can learn from them. Again, let's see if there is any other abnormality. Otherwise, I will fit. X-ray revealed no abnormality. Simple.
much okay tooth-wise. What's the pretty much part of it?
Of late, when I'm brushing my teeth, I find blood in my saliva.
While I was brushing my teeth, while brushing, I automatically guessed it priorly. That is how your mind should work in the final exam, that you should be able to fill at least two or three blanks just by your common sense. It will give you lot of relief, lot of psychological satisfaction in the start. Obviously you will perform better. So while brushing, now my preposition is from, but suspects is coming from gums, because there is no other place that you can have blood from. Let's see.
It seems to be coming from the two front ones. I don't know what to make of
Coming
that.
from two front ones. That is what he has spoken. So I was wrong in guessing, but yeah, two front ones. Again, I will play it for you.
Seems to be coming from the two front ones. I don't know what to make of that.
Does it hurt at all?
No, there's no pain, just blood.
Well, it's unlikely that the blood is
Now
coming
my next blank is flosses. How many times? Flosses twice daily, daily, before sleeping. Let's see.
from your teeth, but it's possible that you may have gingivitis. Do you know much about that?
That I've been eating too much ginger?
No, not quite. Bleeding gums are usually caused by plaque buildup. You see, plaque contains germs that attack the healthy tissue surrounding the teeth, causing them to become inflamed or irritated. Have you noticed that your gums are particularly swollen?
No,
How's your breath after you brush? Any lingering bad smells or taste?
not that I've noticed.
Okay, good. And it's a good thing you told me about it because at this stage, it's easily treatable and completely reversible. Can you tell me about your brushing and flossing habits?
Yes, I brush twice a day. First thing in the morning and last thing at night. Never really got into flossing.
I'd really
Never been to flossing. Flosses never daily, not fitting in. I don't know what should I fit, but he's saying never. Okay, let's see.
recommend it. You see, your toothbrush,
Yes, I brush twice a day. First thing in the morning and last thing at night. Never really got into flossing.
I'd really recommend it.
Flosses never daily doesn't make sense, but that's the only thing I can fit. Flosses, yeah, can't help it. Again, this blank is also hard. Obviously, for you, all the blanks were hard. I understand, but I'm just telling you what you can do about it. It's just with the positivity you can do these kind of listings and can feel more positive. But don't judge yourself on the basis of these kind of listenings. Don't say, oh, I'm bad at listening just because of this listening. You can't say you are bad, because this listening has to be little balanced, and in the final exam, balanced exam will come. So don't worry about these kind of things. Please don't become negative because of these things. We'll consider dash of flossing products. Let's see.
You see, your toothbrush can't reach everywhere in your mouth, and even if you have an electric one, it's unlikely to reach between your teeth. That makes flossing the best way to remove any remaining food particles or plaque and to prevent decay and keep gingivitis at bay.
I'll bear that in mind.
Ask the receptionist to show you our range. We have traditional floss, but also floss picks and holders.
We'll consider range of flossing products. There is one word range can fit in. I'm not sure, but there is one word they have used, range. Let's see how again, it would be an impossible word, but can't help this listening. So let's try again.
Has what?
Our clinic has range of flossing products. And how did
Show you our range.
okay. Today the net is very, very slow. It's playing up.
Mouth, and even if you have an electric one, it's unlikely to reach between your teeth. That makes flossing the best way to remove any remaining food particles or plaque and to prevent decay and keep gingivitis at bay.
I'll bear that in mind.
Ask the receptionist to show you our range. We have traditional floss, but also floss picks and holders, as well as peroxide brushes that have a handle, but are specially designed to clean between your teeth.
I will. Thank you.
My pleasure. Now, did Amy tell you much about the whitening procedure?
Will consider watching of flossing products. I'm trying to fit everything. We'll consider range of flossing products. We'll consider, seeing the range of flossing products. But again, it's an impossible blank because they haven't used the preposition. Again, can't help it. So you have to understand. And again, the only thing I can say about this listening, that you should not make yourself inactive because of this. And you should not say my listening is bad just because of these kind of listenings. You have to be little positive, guys. This kind of listening will not come. You yourself know. I don't know why do you become negative about these things. But yeah, but we'll consider range of flossing products. That's the only thing. Or we'll consider taking knowledge of these, but he did not say anything like that. Can't help him. But smoking word, I think it should come to my ears, that how long he has been smoking for.
You're here?
She did, and she also gave me a kick up the bum for not quitting smoking. But I will soon.
Well, you certainly can't smoke straight after the procedure. Otherwise, it'll be counterproductive. How long have you been smoking?
It'll be 6 years this month. I've wanted to quit for a while now, I just haven't got the willpower, you know? I'm getting booked more often these days, and the pressure's been ramping up as well, so I'm just stressed. You know?
I understand.
I managed to quit just before the marathon, so I'm hoping that the price tag on this treatment will motivate me as well. I just need that carrot or stick.
Maybe motivated by the price tag of the treatment. So this I could do, price tag, that price of the treatment, because he said that I would, but that is the play between active and passive. He said price tag may motivate me, so it was an active sentence. That was converted to passive, that patient may be motivated by price tag. So again, you have to learn active and passive. Obviously, in the final exam, again, I'm telling you, this kind of hard blanks will not come, but active passive you should know. So he used the same word may model. He said price tag may motivate me. Again, I will make you listen.
I hope so too.
And even 23rd blank was impossible. 23rd blank was also impossible. So can't help it.
I understand.
I managed to quit just before the marathon, so I'm hoping that the price tag on this treatment will motivate me as well. I just need that carrot or stick.
I hope so too. All right.
Okay, so it was a little hard listening for sure. If you could not do it, I am also, out of the 12 blanks, I can do maximum 7 to 8. That's it. If you have done 5, 6, 7, 8, it's all good. If you have done more than 8, that is, then you are brilliant than me. You are better than me. You don't have to worry about anything. Yeah, but I would like to do this 23rd blank again, and 21, I don't know. 23rd, I will like to listen to it again, and then we'll discuss.
How long have you been smoking?
It'll be 6 years this month. I've wanted to quit for a while now, I just haven't got the willpower, you know? I'm getting booked more often these days, and the pressure's been ramping up as well, so I'm just stressed. You know?
I understand.
I managed
want to fill the word stress, but stress does not go with numbers. So that is the problem. So that is why I'm unable to fill this. Otherwise, pressure at work due to increased stress, then I would have done. So can't help it. So this listening was very, very hard. So if by chance you had bit of a trouble in this kind of listening, you should not worry at all. Please don't worry about these kind of things. It is not good to discourage yourself because of these kind of listenings. Okay, so now obviously we will discuss, and I will unmute you and will ask you what kind of problems did you face. And obviously you would have faced problems like me, and we will discuss that now. Okay. Just a second. Okay, guys, now you can participate and can let me know whatever. And there's so many listenings you can do. If one listening is not good, you can skip it. You can do some other listening. There are so many listenings. So don't worry about any particular listening. But yeah, okay. Any doubt in this thing? And you can tell me the answers as well. 13th was the answer. 6 months ago, whenever whatever he said, last checkup. Can you help me, guys, with the blanks? Oh, today it is very, very slow, I guess. I can't listen to anyone. Yeah, it's my fault again. Yeah, 13th blank, please. 13th blank.
6 months ago, sir.
Right. Recently participated in.
Marathon.
Marathon.
So that is the only thing that could have happened. So I was right in guessing. Then reason for visit, whiter teeth.
Whiter
Yes,
smile.
sir.
Whiter,
Whiter smile.
that is what he said. Occupational presenter, interview presenter.
TV.
Presenter.
Presenter.
Presenter, sir.
So even 16th was right. X-ray revealed no abnormalities. This is 100%.
Yes, sir.
While brushing,
Yes.
percentage suspect is coming from two front teeth.
Yes.
Perfect until now. So 13th right, 14th right, 15th right, 16th right, 17th right, 18th right, 19th right. So I've already scored almost 5. Okay. Let's go ahead. And then 20th flosses. Yeah, that I 100% do not know. Flosses dash daily. Never daily. Flosses 20th blank.
0, sir.
Flosses 0. Yeah,
4 times.
4 times to know. 4
Zero, sir. Zero.
Yeah. Okay.
No.
So again, this blank was not right. It was not given in the right way because I could say
No time.
I do brush my teeth, but I do not. I don't know about flossing. Okay. Will consider range of flossing products. That was the
Yes, sir.
Yes.
Yes, sir.
Yes,
Yes.
sir.
has been smoking for 6 years. That's what he spoke,
5
5
years.
years, sir.
or whatever he said. But
6 years.
6 years, that is what he said. That's what I think. 6 years he said. And due to increased number of working hours,
Booking.
Smoking.
no smoking.
Booking, sir.
Bookings. Okay, increased number of bookings. And last price tags.
Price, sir.
Yes. Price.
So only 23rd is something that was impossible for me. Again, now, and trust me, I don't know whether I have done this listening, but 99% I have not done it. It's just maybe one thing, I am a dentist. Second thing is I could guess this listening, and that is what happens in the first 30 seconds. 30 seconds are very crucial. Don't take them for granted. What can we do in 30 seconds? We just wanted to focus. Read the topic. Try to understand there is a male. He's very good with his body because he has a good diet. He goes to gym. So obviously most of the times you will see even in the metro countries now in our country, most of the people participate in marathon. So that is where you can guess it. And then reason for visit White Smile because I take interviews, I do work, and sitting on a TV. Presenter does not have a good smile. He's having stain on the teeth. So the only thing I could find was presenter because I told you occupation means doctor, engineer, ER words, doctor, engineer. Then we have words like many other most of the occupations are with the word ER, like presenter, interviewer. ER word tells that what is the occupation of a person most of the times. Then X-ray revealed no abnormalities because he said so. Brushing, I already guessed, coming from gums, but it coming from two front teeth, so I could guess it. Then flosses, not daily means daily word was given wrong. Flosses 0 times a day. Range was the only word she was talking about. That we have range of products, some with the handle, some with other kind of floss. We have different kind of flosses. We have range of flosses. So he used the word I will bear this in mind. Bear word means consider. I will bear this thing in my mind. That means I will consider. Bear word is a very important word. So please bear this in mind means please consider this. So that is what patient said. I will bear this. Has been smoking. This was the easiest blank. This 22nd. 23rd was very, very hard for me. I could not really guess the word bookings. But 24th was really easy for me because he said price tag of treatment may motivate me. So it was active, and I know about active passive, that when there is a passive sentence, it becomes be plus third form. I should do my work. My work should be done by me. So it will always happen in the reading, and the same thing will happen in the listening. So out of the 12th 12 blanks, I could do 11 right, just with positivity and willingness to do and to understand the topic. First, obviously, is positivity, because that will help you to work hard. That will motivate you to read the topic beforehand, and that will help you to execute. So please, when you are optimistic, 30 seconds. Otherwise, suppose if you are not positive, you will waste your 30 seconds watching here, there, waiting for, or maybe will forward the listening. Yeah, please utilize those 30. They are giving you 30 seconds to understand the topic. So don't waste it. It's very precious. So these are the things which can be learned. And please listen to this recording again and again. If it is boring for you, can't help it. But again, if you want to do 11 questions right out of 12 in that kind of typical hard listening, then obviously you should consider listening to this listening for 2-3 times. This is Dr. Bhupesh from Dr. BK Moiti Institutes. Again, guiding you is just about feeling positive about things, and things will work out for you. Thank you very much for listening to this video. Thank you.